Hello, my name is Regina Brown, and I am here today on behalf of my group, Mothers Advocating Good Health. And I would like to speak today on why my group feels that vaccination should be federally mandated for mumps. So I would like to talk about how this public health issue affects others and the impact that it has on the community, as well as why this needs to be addressed. Some of the other things that I will be covering is who will be affected by this policy, the costs and benefits of the policy, as well as how the lives of those affected will change if this policy is enacted. So first we will go over some of the basic facts about mumps. So as recently as last month, the Department of Health here in Hawaii, where I live, has been investigating the increase of mumps around the state. Currently, none of the folks affected by the disease have been hospitalized, which is a great thing. However, some of the more detailed information about mumps is that it is a contagious disease caused by a virus, and the usual symptoms are swelling of the salivary glands, which are right beneath the jawbone, and a person who is in the early stages of mumps can also have fever, headache, muscle aches, tiredness, loss of appetite. Usually these symptoms will start anywhere between 16 to 18 days after the person has been exposed to the virus. And in children, the disease is usually pretty mild. However, adults can experience some complications, such as meningitis, which is an infection of the area covering the brain and the spinal cord. Also deafness, sometimes temporary, sometimes permanent. Encephalitis, which is swelling of the brain. Orchitis, which is swelling of the testicles in men, of course. And then ovaries, which is swelling of the ovaries in women if they have already reached puberty. So even though some of these things that I just mentioned are the worst case scenario, most people with mumps will recover in just a few weeks. So next, I want to talk about how mumps is usually spread. It's usually spread through the saliva or the mucous membrane from the mouth or nose or throat of an infected person. And this infected person can spread mumps by coughing or sneezing or talking, sharing items such as drinking cups or eating utensils with others, touching things and other surfaces with clean hands that have not been cleaned, especially if the person has coughed into their hands. People with mumps are most infectious within the first few days after they have been exposed to the virus, usually when the swelling of the salivary glands on their face is present. Anyone that has mumps should stay away from others as much as possible, which would mean staying away from work or staying away from school. And they should not travel up to 9 days after the start of the symptoms. So how is mumps diagnosed? Usually through the combination of the symptoms and the physical signs and lab tests is how one would know for sure that they have mumps. And people with mumps should contact the healthcare provider immediately. And that healthcare provider should also report the mumps cases to their health department, which will also continue to channel up the confirmed diagnosis of mumps. To treat mumps, there is no specific treatment for it besides just caring for the person that has been infected, making sure that they get lots of rest, lots of fluids, and to just keep their fever under control. So how are people immune to mumps? So adults who were born before 1957 are thought to be immune to mumps. People who have had a blood test showing that they are immune or have already had the disease, and people who have written documentation that they have had an appropriate mumps vaccination. The best way to prevent mumps is to get vaccinated, which is why I'm here today. So children should receive 2 doses. The first dose should come anywhere between the age of 12 and 15 months, and the second dose should come between 4 and 6 years of age. All adults who were born after 1957 should be vaccinated unless they have already been vaccinated. And then teens and adults should make sure that they keep their vaccinations up to date. So those are the people that the mumps can affect. So when we ask the question, who can be affected by mumps? Well, anyone and everyone, because mumps has been confirmed in both adults and children, those vaccinated and unvaccinated. So as recently as last week, here again in Hawaii, there were 119 cases just this calendar year alone, and we're only in June. Most of those cases were in adults 18 years and older. So the impact of this health issue on our community is just that the spread of the disease will be more and more, which could lead to an outbreak. And that outbreak would lead to more people missing school and work. So this health issue needs to be addressed because we want to reduce the number of cases and ultimately eliminate mumps altogether in the United States. And although the cases in the United States are not that widespread, if this vaccination is mandated, then we could return to the pre-vaccination numbers and the reported cases in the coming years. So the proposed health policy is for there to be a federal mandate for all children between 12 months and 12 years of age to be vaccinated with the mumps vaccine if they have not already. The vaccination process would align with the recommendations of the CDC. Those recommendations are that children receive the 2 doses between 12 and 15 months, as mentioned earlier, and then again the second dose. The first dose would be between 12 and 15 months, and the second dose would be between 4 and 6 years. So if this legislation were to be passed, the effect would be nothing but positive. And that is because the extensive vaccination plays a huge role in limiting the size, the duration, and the spread of the mumps outbreaks. So by enacting this policy, there is also the possibility of protecting against the current circulating mumps strains. So when we talk about how costly not enacting this legislation could be, there is one example of an evaluation of a mumps case that was occurred in New York in 2010. So there were 42 public health personnel who participated in the outbreak response. Approximately over 7,700 hours were spent by those people, the majority of which was analyzing the database and report preparation, case finding and isolation, response planning, and school-based vaccination. The total estimated cost to the U.S. for one state alone in New York was $463,000, 302 cents, which 89% went to personnel costs, including fringe benefits, and a total of 1,812 doses to prevent mumps. So the risk of not enacting this policy is a possible epidemic and continued waste of resources that could be spent elsewhere. That was a lot of time and a lot of money that could be spent on something else. So the things that I would like for you all to take away from this today in order to convince our constituents of why this is a legislation that should be passed is that this vaccine has been proven safe and effective, because there are those out there who are against vaccines because they think they are unsafe, but this one has been proven to be safe and effective. In fact, there has been a 99% decrease in mumps cases nationwide since vaccinations have been started and administered since the 1950s. And since this disease is so easily transmitted, it seems that every parent should want to be able to protect their child against this disease. So regardless of whether a child is homeschooled or if they are cared for at home by a mother or a caregiver in their home, at some point this children will come in contact with someone else. So these are the kinds of things that need to be conveyed to the constituents, to the voters, to make sure that they understand why this legislation is being proposed and should be passed. So today I hope that I have convinced you all to pass this federal mandate to have mumps vaccination become a law for children. And I've talked to you about why it's important, who would it affect if it does and does not happen, and why it is such a great thing for this law to be passed. So again, my name is Regina Brown, and I am here on Mothers Advocating Good Health. Thank you, and have a good day.